In the wake of Tuesday's deadly attack at the Buffalo Allina Clinic, security concerns are surfacing.
Immediately when I first saw the headline, I was taken right to my clinic thinking, how would it be handled? How would we manage things?
A recent survey of members from the Minnesota Nurses Association revealed 95% of MNA nurses do not feel safe from violent attacks at work. But for Minneapolis primary care doctor Hannah Litson, who's not affiliated with Allina Health, the issues around safety come down to workplace environment. She says places like clinics and ERs are most vulnerable.
We hear all the time about people who've experienced threats or even assault from patients who were unhappy about the care they were given.
Which is why organizations like MNA have been and continue to push for action from lawmakers and workplaces so incidents like the shooting in Buffalo don't happen again.
If people are feeling unsafe, I think it's important that healthcare organizations take the steps they need to ensure that their employees are safe.
Allina Health released a statement saying they have increased security at their facilities, and with many already hesitant to visit the doctor because of the pandemic, Dr. Litson hopes this isolated incident doesn't keep people from receiving the care they need.
I think it's important for all of our patients to remember that it is safe to come and see your doctor when you need care.
Devon Roming, KARE 11 News.
Officials with Allina Health say on top of adding extra security, they're also providing spiritual and mental health resources for their staff.